Hello, I'm Rico Cavella, and this is your Ageless Body Self-Care Guide. Operations Manual for your body and for your mind. And the title of today's session is Gut Health, all about our gastrointestinal tract. You know, just just really in the last several years, it's really become to light, you know, how important our gut health is. So this is going to be a really important one. So you want to really pay attention. This is going to be something that's going to be really helpful for you. And we're very fortunate to have a great expert with us today. Her name is Dr. Mary Pardee. She is a functional medicine doctor who specializes in gut-brain health. So Dr. Mary Pardee, thanks so much for being here.
Thank you for having me, Rico. It's a pleasure.
Okay, good. So, you know, I like the line you have on your website where it says, gut health affects everything, your happiness, your energy, your confidence, and your health. That just about says it all, right? And that's for all things that are important. So that just shows you really, I like how you put that up there. So we're going to talk about all those things, how it affects all those things. But let's begin with, I think it will be helpful for our viewers to really explain exactly, you know, what makes up our gut and what is it exactly, what does it do for us?
Absolutely. And this is a field that has been expanding in the last 10 or 20 years. The number of articles that have been written on the gut and the gut microbiome is exponentially increasing year after year. And it's so exciting for us, especially me, who's in integrative gastroenterology. And so the gut is comprised of something called the microbiota. And this is a collection of viruses, fungi, bacteria, all of these microorganisms. There's about 100 trillion microorganisms, 10 times more cells than the human cells that we contain. And this collection contains the microbiome. So there's a difference between the microbiota and the microbiome. The microbiome is the collection, the genome that is encoded in these bacteria, fungi, viruses. And this is really where the magic happens, because we have about 20,000 human genes, right? And those encode for proteins, and the proteins allow us to produce hormones and different products in the body. Proteins are the basic building block of life. Now, the microbiome also encodes for genes that encode for proteins that can then produce substances that interact with our human cells. And so these are postbiotics, and this is really where the interaction between the human and the microbiome exists. But there's about 3 pounds of bacteria in our intestines. And so the collection of that microbiome and our human cells in conjunction is called the holobionte. So we are not just human, but we are human plus our microbes. And that's really important because our behavior, our mood, our physiology is all influenced by what resides in our gut. It's pretty fascinating.
Yeah, totally fascinating. That was really well explained. Yeah, it is totally fascinating that, and the interesting thing, isn't it, that we couldn't exist, we couldn't live without all these viruses and bacteria, and especially in the soils and in our gut, everywhere. It's the most, it is the thing that makes up the most of all of everything, right? Or our planet and our bodies and everything, right?
Absolutely. And it's not just in our gut. We have a microbiome on our skin, in our nasal passages, in our ears. We now know that the amniotic sac is not sterile, that we were birthed from. We used to think that that was a sterile environment. So that's actually the first exposure as a human that you get to microbes is in utero. The vaginal tract is another exposure early on in life when you're delivered vaginally versus C-section babies actually have different microbiomes than vaginally birthed babies. So we have a microbiome all throughout our body, and it's really a symbiotic relationship, meaning that they help us and we provide them with a place to live. And we can look at how the microbiome affects us through looking at animals when we take out their entire microbiome. These are germ-free animals. Germ-free mice are the most common model studied, but we can see a lot of changes when you take out the microbiome. Weight changes, ability to digest calories and absorb nutrients changes. Your metabolism is altered, brain function can change. So these guys really do a lot for our human body.
So tell us a little bit about how that works. You know, how science has shown, you know, how important our gut health is, but I mean, how does it actually physiologically, how does it work, and how does it really affect, like as you say, our happiness, our energy, our confidence, and our health?
Yeah. One of the most common axes that we talk about with the gut is the gut brain axis. There's also the gut liver axis. There's the gut kidney axis. There's the gut everything axis, because there really is bidirectional communication to almost every organ system in the body. But Harvard, Cleveland Clinic, Johns Hopkins University, these are renowned medical institutions, right? And they all recognize that the gut can affect our brain health. This is bidirectional, meaning that the brain affects the gut affects the brain. It's not one or the other, but it is really communication that happens between the two. And intuitively, people with gut issues, if you have IBS, inflammatory bowel disease, or other gut conditions, so irritable bowel syndrome is usually constipation, diarrhea, or a mixture of both, Crohn's and colitis, IBD. Now, if you have any of these gut conditions, you intuitively know that your gut affects your mood, because if your gut isn't functioning well one day, your mood is going to be altered. And if your gut is functioning perfectly one day, you're like, wow, I feel so much better. So it's very intuitive, but how does this work on a physiological mechanism, right? Like, what is actually happening that this can be affected? So there's a couple ways that the gut and the brain are connected. One of them is the vagus nerve. So it's a physical connection between our gut and our brain. The vagus nerve innervates everything from the mouth all the way down to the lower part of the GI tract in the colon. And so it can send information to the gut through this nerve. And then we can also send information back from the gut to the brain through the vagus nerve. There's another way that we connect the gut and the brain, though, and this is a little bit more exciting for me because I think that there's a lot of potential in the research here. And this is through postbiotics. So postbiotics are the products that your microbiome actually creates based on what you consume in energy, amongst other things. So say you intake a lot of vegetables that have fiber in them. Your bacteria break down that fiber, because we actually as humans can't break down fiber. That's why there's no calories in it. We can't digest it. But our bacteria can go and eat that fiber. And when they eat the fiber, something that they produce are short chain fatty acids and other postbiotics. Now, these molecules can interact with our human cells. They can talk to our nerves to alter serotonin production, GABA production. They can go travel to the brain, cross the blood-brain barrier, increase BDNF, brain-derived neurotropic factor. This is the kind of power molecule in the brain that helps create new neuronal connections. And if you're into brain health, BDNF is one of the keys to brain health, is really creating different roadmaps to similar parts of the brain, so that if you have any deterioration, which naturally occurs with aging, right, that we have other ways to get there. Also can speed up directions, make you cognitively in a better state. Now, it's really important that we also look at how your gut affects your brain in terms of inflammation. So inflammation in the gut can actually cause hyperexcitation in areas of the brain, and this can result in negative mood and negative feelings. So that's another mechanism where the brain and the gut are intimately linked. And on the flip side, if you give a rat with ulcerative colitis, now if there's abnormal inflammation that exerts there, so there's something going on there, it can create a fear center in the brain, the amygdala, to light up. So we can see how inflammation directly affects our brain health there. So those are the two big ways that the gut and the brain are really closely linked: postbiotics as well as the vagus nerve.
Yeah, well, really well expressed. Thank you so much. I think what's interesting is like the point you made too, that every cell, everything in our body is always communicating with each other. That's something that we've really been learning, how everything is communicating. Everything's connected, just like in the whole universe, right?
Absolutely.
Everything's connected. Yeah.
And it's a systems approach to health as well. So, we're not going to just look at the liver independent of the gut, or we're not going to just look at the thyroid function independent of your other sex hormones. We have to look at the body as a symphony. You can't just have a violin playing alone in a symphony. It wouldn't be a symphony. You need all of the instruments in conjunction playing harmoniously together.
I like that analogy. It's a symphony. Yeah, it surely is. And well, that's what functional medicine is all about, right? And also, I want to add too, people have heard of prebiotics, and you mentioned the fiber that the probiotics feeds on. That's what's called prebiotics, right?
Yeah, so fiber is a prebiotic. It's going to be the food for your bacteria. The bacteria itself, we call probiotics when they're taken in an oral form, right? So if you take a probiotic, you're actually taking a capsule of bacteria itself. And then once your bacteria eat the prebiotic, they produce postbiotics. So we have a few terms that are all around this biotic picture, either before it's consumed, the microbe itself, or the product that the microbe produces.
I know you've already touched on this, but maybe just for clarity for our viewers, what are some of the most common health challenges that are directly related to gut health?
Yeah, so inflammation is definitely one of them. So if your gut is not functioning properly, then we want to really see, is there systemic inflammation going on? And we can actually look at different molecules that could be affecting inflammation in the body from a gut perspective. LPS, lipopolysaccharides, are produced by some gram-negative bacteria. And so in functional medicine and naturopathic medicine, we talk about dysbiosis, which is an imbalance of bacteria that can be present. And this is especially true when you have too much gram-negative bacteria producing LPS, which can create inflammation. It can also cross the blood-brain barrier and cause some inflammation in the brain, causing brain fog, foggy thinking, difficulty concentrating. So you can see how concentration and gut health can be affected there. And then we also have products like butyrate. Butyrate is one of those short chain fatty acids that I was talking about, and this actually helps to dampen that inflammation. So we want to make sure that we have enough fiber present to produce butyrate. And then in terms of what can be affected, you were asking conditions, right? Like that could be affected with brain health. And so we talk about depression and anxiety when we talk about the gut-brain axis. This is because of that inflammation in part too. Neuroinflammation in the brain we know is higher in people with Crohn's disease, inflammatory bowel disease. They also have higher rates of depression. So one of the possible mechanisms is this inflammatory process being systemic, causing neuroinflammation and either exacerbating or causing or being a part of the depression piece. I do stress being a part of because I don't think conditions are usually one cause. I think they're usually multifactorial, right? But we have to take into consideration that issues in the gut could be exacerbating or being a part of that puzzle that leads to anxiety and depression. Also metabolism. We know that weight maintenance can be affected by your gut microbiome. We've seen this in mice. We haven't seen it as much in humans yet, and my hypothesis is more that we haven't pinpointed what exactly is going on in the gut microbiome. But an example in the mouse model is if you take a lean mouse that has a normal body weight to height ratio and you transfer the feces from the lean mouse into the obese mouse. This is called fecal microbiota transplantation, which we do in humans sometimes. But if you take the feces of that lean mouse and you put it into the obese mouse, what we see is fascinating. The obese mouse loses weight and becomes thin like the lean mouse.
Oh, wow.
Now, the opposite is true as well. If you take the feces from an obese mouse and implant it via FMT into a lean mouse, that lean mouse will gain weight. So what we see there is this communication between your metabolism, which largely is happening in the liver. So liver is really a big center for metabolism. And so those bacteria are producing things that are interacting with genes in the liver to change transcription factors and re-regulate your genes, how we're expressing them actually, and changing metabolism so that we can maintain a normal body weight or that we gain weight if it has different bacteria present. And so this hasn't been shown as much in the human model. There's been a couple case studies that have shown FMT cause people to gain weight, but not as much. But I think that if we find this super donor, meaning like what does the optimal human microbiome look for metabolism, that we could really see changes in the human microbiome in the future by figuring out which microbes need to be present in conjunction with other microbes to induce the same effect. So metabolism, we talked about mood issues, anxiety, depression. Other ones are autoimmune conditions. So autoimmune conditions, if you talk to functional medicine doctors, we really are saying are rooted in inflammation. And so I've talked about inflammation so much, but butyrate's ability to reduce inflammation when the proper short chain fatty acids are there, as well as LPS's ability to increase inflammation. But all of these short chain fatty acids can regulate different cytokines, and cytokines really have the ability to spruce up inflammation or to decrease it. So we're looking at all inflammatory conditions really, but autoimmune conditions are on the rise with, you know, changes in society. And so this is a really important one. Autoimmune conditions are things like rheumatoid arthritis, Hashimoto's, multiple sclerosis. These are all autoimmune conditions, and our ability to regulate the immune system is largely dependent on our ability to regulate inflammation in the body. The last one I'll talk about, which I think is really interesting, is dementia, brain-based conditions, but especially dementia, which is one of the leading causes of death, is cognitive decline. So with dementia, we're looking at the ability for the gut microbiome to be talking to the brain to help regulate different processes. What we see in Parkinson's disease is that actually one of the first signs of Parkinson's is constipation. So we have gut-based symptoms that are preceding any cognitive changes that happen in Parkinson's disease. But really an idea that maybe there's something going on in the gut that's changing the brain in certain dementia patients.
Wow, thank you for that. That was so well said. So I think, again, I just want to stress the main point I think we want you to understand is that what's going on in our gut is so important, it's affecting everything. So again, if you're having some problems with depression, you have to look, not just, you have to look at in your gut is one of the first places that we should realize that everything is so connected. And I think you really explained that really well. So let's talk just real briefly on what are some of the lifestyle habits that we have that are really depressing our gut health.
Yeah, the biggest ones that I see in my practice are, number one, the standard American diet. And so pretty much any diet's going to be better than the standard American diet. We're talking about the standard American diet being processed foods, heavy in carbohydrates that are processed, breads, pastas, things like that, sugar. The standard American diet causes inflammation in and of itself. And it's also very low in fiber. So really switching to a whole foods diet that is rich in vegetables. 3/4 of your plate should be vegetables. That means like 6 to 9 cups of vegetables daily. So diet is a big factor that's going to affect gut health, either negatively or positively, depending on where you go with it. Exercise is another one. So being sedentary is a huge thing for your gut, and it affects your gut in different ways. It can actually change your microbiome, how much you exercise. So we can actually see a shift in the microbes present, but it also can activate your vagus nerve. So things like walking will activate the vagus nerve to stimulate motility, regulate gut movements. Another one besides exercise is going to be maladaptive stress response. And so I say maladaptive because stress is not bad. We need it to evolve as a person. However, it's how we respond to that stressor that really determines if it's good or bad for our body. And so if you have a proper stress response where you can see a stressor, handle it, and then move away from it or move through it, then that's appropriate. But elevated levels of cortisol, meaning that you're allowing the stressor to affect you for a prolonged period of time, or you're burnt out, or you're doing too much, or you're not giving time for yourself in terms of self-care, relaxing and replenishing, then you're going to see elevated levels of cortisol for a prolonged period of time. Cortisol to the gut, if it's too high for too long, decreases secretory IgA. Now, this is an immunoglobulin that actually helps protect our gut lining. It's so, so important in prevention of something called leaky gut or intestinal permeability. And this intestinal permeability can lead to food sensitivity. So if you are somebody who can't eat broccoli, Brussels sprouts, all of these healthy foods, right? So food sensitivity versus just eating bad food that you react to is different. So I stress, if you can't eat healthy foods and you react to them, then that is a sign of possible intestinal permeability or leaky gut that could be affecting your overall health. And one of the keys to that is stress regulation, decreasing cortisol over a prolonged period of time so that you can produce normal amounts of secretory IgA that will protect that gut lining. The other thing is a kind of a no-brainer, but we don't think about it in terms of gut health, is sleep. So sleep is where we produce a lot of melatonin. And melatonin, yes, helps us fall asleep, stay asleep, but it's also very anti-inflammatory. Your gut actually produces more melatonin than your brain does. And it's not necessarily to keep you asleep, but it's to actually go in and repair the gut lining, decrease inflammation, and help regulate motility. A lot of our gut cells are actually clock cells, meaning that they function differently in the night versus they do in the day. And they need that difference to properly regulate your gut function.
Again, so well explained. Thank you so much. And you know what's so interesting to me always is that uh, yes, there are specific things we need to do for different specific health challenges, but really when it comes down to is what we know that we all need to be living a healthy lifestyle, right? It all comes down to the same thing, right? We need to eat real, like you said, live whole foods. We need to exercise regularly. We need to get sleep. We need to reduce stress. All the things that make up a healthy lifestyle are the things that we need that will actually solve a lot of the health challenges that we're having.
100%. And sometimes, especially in alternative functional, anti-aging medicine, we go first for the supplement. Like this is the prebiotic supplement I need to take for my gut health. But you're not sleeping well, you're not exercising, you're not eating well. It's like, get the foundations in place, get them super, super solid. You will likely solve 99% of your problems, and then we can play around with supplementation. But if that foundation's not in place, don't go wasting your money on additional supplements. Get the foundations there first.
So good. That's the right information, folks. Okay, so just real briefly, tell us a little bit about how you deal with people that are having gut problems. And I know you have a whole gut health course. So just tell us a little bit about that.
Yeah, absolutely. And so my practice is called Modern Med, and we have health experts, doctors, health coaches that can help people with their gut symptoms. And so we really specialize in functional bowel disorders, things like irritable bowel syndrome, constipation, diarrhea, bloating, things like that. We also help people with Crohn's and ulcerative colitis, IBD, reflux, a whole host of gut conditions. And so we work with people one-on-one to help them heal their gut naturally, or as naturally as possible, with integrative medicine. We use nutrition, exercise, sleep, stress, all of this. We usually do it via telemedicine, actually via Zoom. That's a HIPAA compliant version. And we do that from the comfort of your home. We can send test kits to patients to help them identify what is the actual cause, because you want to know what you're dealing with before you actually go and treat it, or else you're kind of just seeing what sticks and hoping that something works. In the gut health course, which is another way to learn a lot about what we do at Modern Med without working with us one-on-one, we cover all of these gut conditions. So we cover SIBO, small intestinal bacterial overgrowth, small intestinal fungal overgrowth, IBS, how those are related. Again, we cover IBD. We talk about helminthic therapy, which is worm therapy for gut health. We talk about fecal microbiota transplantation. We talk about leaky gut or intestinal permeability, food sensitivities, how they develop and how you heal from them. And we go into probiotics. Do you actually need one? What are they? How do they work in your body? Do they actually recolonize the gut microbiome, which most people are surprised by, but they do not. But can they be helpful in other ways? Yes, they can. And we talk about advanced gut testing. So conventional doctors will maybe do a stool test if you have diarrhea. They're going to do a basic blood panel. But what other tests do you need to identify what's going on in your gut if you have gut symptoms? And so the gut health course covers all of that. It's 10 days of information. It's a ton of content. It's basically a download of my lab brain and my gut health brain to really help people that can't work with us one-on-one directly, or just aren't ready yet to work with us.
Well, that's so good. So first of all, just on that same note, I want to remind all of our viewers that there's a PDF that comes with this video training, and you have a transcript of what we've just been talking about here with Dr. Mary. And then also you have all her contact information. As she mentioned, you can go to her website and you're going to get lots of good education. You can learn so many things. And if you really have a serious condition, then you can see how you can work with her as well. So we definitely encourage you, to check out the PDF, because you're going to get a lot more really information that'll really help you as well. And I always have to say, I say this almost with every interview, but I think it's just an important message to stress, is that, our medical system, our healthcare system, well, really our healthcare system is really a disease care system, right? Our mainstream medicine tries to do something for you when you already have some health challenge. So we've got it backwards, what's called alternative medicine, like what you do, Dr. Mary, functional medicine, and like naturopathic doctors, it really should be that's our mainstream medicine, because that's how doctors are trying to help you to get your body back in balance so your body can heal itself, and it can. And what's called our mainstream allopathic medicine, who just came in and just kind of took over, right? that should be alternative. You know, there drugs and surgery and all these things, they have their place, but that's an alternative, right? That should be alternative medicine, and what you do, it should be our mainstream medicine.
Yeah, I think you definitely said that really eloquently. And the big picture too is there's room for both of us. And so, like you said, it's not one or the other. It's, you know, I think functional medicine, naturopathic doctors really are suited for prevention. Stop anything from ever happening, you know, making sure that we're doing things to monitor and enhance health as much as we can so we never have to treat a disease process versus waiting for the disease to develop to start treating it in the first place. And I think that's really what separates the two. If I break a bone though, or if I crack
Yeah.
my head open, I'm going to the ER, and I'm very, very
Yeah,
happy
absolutely.
for conventional, you know, allopathic medicine, because they are better at that than anybody. So I think that it's really just looking at medicine from a different perspective.
Yeah, yeah. Mainstream medicine, when you have an acute situation, they can definitely save your life and put you back together, and that's where they're really great at, you know. But unfortunately, you know, for most chronic illnesses that people are dealing with, their methods are not only usually not very effective, but they can be downright dangerous. So you definitely want to consult with a doctor like Mary. Okay, well, so let's bring us down to the last thing here. We can kind of sum it up here. So give us what you would say the top, say, 3 to 5 things that you recommend people that they could begin doing right now that could improve their gut health.
Yeah, and I want these to be super actionable and detailed. So number one is increase fiber. And so if you have gut issues to start with, if you have bloating, diarrhea, constipation, this actually might be too much for you. So that's where working with a one-on-one practitioner will be helpful. However, if you're in a good place, increasing fiber can improve your gut health. So the average American consumes about 15 grams of fiber on a daily basis, about half the recommended amount that the RDA recommends for fiber intake for the US population. The average hunter-gatherer, meaning like the Hazda tribe has been studied and they're still living off the land the way our ancestors were, consume about 100 to 150 grams of fiber daily, about 10 times the amount of fiber that the average American is consuming. And we know that these ancestral tribes, they actually have a heavier weight to their stool because there's more volume to it, because there's more residue from fiber. This is going to change your body's ability to produce those short chain fatty acids and those metabolites that really affect all areas of your gut, every single organ system. So increase fiber intake. Now, if you don't want to go counting your grams of fiber, start with trying to get 6 to 9 cups of vegetables per day. That's a great place to start, and you may want to increase it based on where you at, based on your height, your weight, you know, if you're very petite versus you're a bigger guy. So that's number one. And number two is going to be that stress regulation. So making sure that you have a good adaptation to stressors. This can be through meditation, you know, transcendental meditation, mindfulness meditation. But another part that I think is really, really important, independent of which sort of mindfulness or meditation you choose, is to get back into nature. So our body responds differently when we're in our natural habitat, and our natural habitat is nature. It's getting into the woods, it's getting into, you know, the streams, the brooks, getting to a place of quietness and really reflecting from an internal perspective. And I'm super passionate about this because I don't think that this is something that is individual to the person, meaning some people need to be in nature, some people don't. I think it affects our nervous system to such a level that it's essential for all of human health.
Yeah.
You know, we really upregulate and balance the parasympathetic and sympathetic nervous systems when we're in nature. And our gut functions on that parasympathetic, that rest and digest nervous system. Along with that, walking 10,000 steps per day is another one. And that's a very attainable thing if you put it into your schedule, meaning you do a morning walk, you do an afternoon walk, maybe you go for a walk at lunch. 10,000 steps per day, also pretty equivalent to what our ancestors were walking, which was 5 to 6 miles per day. And that also is going to stimulate the vagus nerve to regulate that gut motility. Next one is an elimination diet. And this is one that you can do safely at home or with a functional medicine practitioner to see if you're sensitive to foods, but also just to give your body a little bit of a break. So taking out grains, gluten, dairy, nuts, processed foods, eggs, protein bars, are processed as well. So taking those out, corn sometimes too, but taking those out, giving yourself 30 days of a really whole foods, nutrient dense diet, and then gradually adding them back in to see if you're sensitive to any of those. The majority of those you can end up adding back in. Some people have an exception with one or two, but it'll help you identify how your body's responding to food.
So good, so good. Thank you so much for that. Okay, so we're down to our last question, and this is the hardest one of all. I ask all of our experts, but I just want again to see if, do you have any ideas? Because I always like to say, knowledge without action is useless, so we're getting all this great knowledge and information, but if you don't act on it, it's not going to do you any good, right? So what ideas do you have, do you say to our viewers to get them to actually, because they're probably saying, that sounds really good, I need to do this, but what can you tell them that to give them a little push so they'll actually begin to do it? Some of your recommendations, yeah.
Well, I think it's just to get clear on your goals. Like, what do you actually want right now in your life that isn't there presently? And what's important to you? So for some people, it might not be gut health. For some people, it might be brain health. But if you've listened to this, you'll also know that those are really intimately connected. So I think it's number one, get clear on your goals. Number two, identify one thing that you can make a change with today that doesn't take hours of your time. But if you look at your iPhone, which counts your steps, and you're walking 4,000 steps per day, you don't have to go to 10,000 tomorrow. Go to 4,500 today, then 5,000 tomorrow, then 5,500. So it's about micro habits, changing things really small, in small increments, so that you can succeed at them and then continue to add on them. So, I mentioned 4 or 5 things that you can do for your gut health. Start with one and start with a portion of it, complete that, and then move on. You'll also see how much better you feel as you do this. So there'll be a bigger drive to actually make the changes.
So good. Thank you so much for that. I just want to add, this is the whole concept of this whole project, the Ageless Body Self-Care Guide, is that we know everybody, wants to be healthy and wants to be successful and wants to have a joyful, productive life. And so in order to have that, how you want your life to be, your health is number one, needs to be your number one priority. So when you begin to take action on all the recommendations from all of our experts, I promise you, you're definitely going to improve your overall health and well-being, and you're going to be able to improve your overall life experience. So that's what this is all about. So it just always comes back down to the most famous, I guess, tagline or saying of all time from Nike: you just got to do it. You just got to step up and start doing it, and you'll be very glad you did. So Dr. Pardee, that was excellent. Thank you so much. That was really, I think that was really helpful. Thanks very much.
Thank you. Thank you for having me, Rico.